This is a really important study that was presented here because it is the first randomized trial in the third-line setting. So it was a trial in patients who had failed VEGF-targeted therapy and mTOR inhibition therapy. So a real third-line setting. And 90% of patients had only these 2 prior therapies, and a minority had more than 2 prior therapies. So with this respect, the study is very important. It is a randomized open-label trial, and it randomized 550 patients. So it was a direct comparison of Dovitinib and sorafenib. The background of the study is that FGF is overexpressed and the levels are elevated in patients who fail VEGF-targeted treatment. And Dovitinib is a tyrosine kinase inhibitor that not only inhibits VEGF receptor and PDGF and c-KIT, but also fibroblast growth factor receptor 1 to 3. So it was reasonable to test this drug, to test Dovitinib in this setting. So coming back to the trial, it was a direct comparison, and the first endpoint in this trial was progression-free survival. And the statistics were based on a 33% risk reduction in favor of Dovitinib. So the first endpoint in this study was not met. So it was a negative study. The progression-free survival in the 2 arms were very similar. It was 3.7 and 3.9 months in the 2 arms, so approaching 4 months. And there was only a slight difference between the investigator and the independent monitoring evaluation of the scans and to evaluate progression-free survival. The overall survival was a secondary endpoint, and also there no difference at all. So the overall survival was 11 months in both treatment arms. The study is important, and we have learned that there is still an unmet need in the treatment for the treatment of this patient population in patients having failed VEGF-targeted and mTOR inhibition therapy. So this is something we learned, and from this study we have the benchmark for further trials regarding progression-free survival of about 4 months and regarding overall survival of 11 months. And any other drug that will be investigated further, hopefully, will have to overcome this 4 months progression-free survival and 11 months overall survival. So this will be important for statistical design of further studies.